Welcome to the collab. I'm Caroline Collins, and I'm so happy to have you all here for the second episode of the show. Today, I have some very special guests in the studio. We have Utopia Plastic Surgery and Med Spa, the one and only Dr. Franklin A. Rose. Thank you so much for coming in. We have Injector Cynthia, and we have our beautiful influencer model today who's going to be getting some minimally invasive things done to her face, Nushin. Thank you so much for being here and being brave enough to do this on camera. Well, Dr. Franklin Rose, you are iconic in Houston, in my opinion. You've been doing this a long time, both plastic surgery and some things that aren't as invasive.
Well, yes, I've been in practice now for 40 years, and we have our lovely nurse injector, Cynthia. So today we're going to sort of talk about facial rejuvenation, and we're going to start with the less invasive procedures such as Botox, fillers, and you're right, Nushin is so sweet to allow herself to be injected by Cynthia, and then a little later we'll bring a patient who's had more invasive procedures, a so-called stem cell triple layer facelift, that being Jennifer, and it's nice to be here with you, Caroline.
Oh, thank you, and all of your patients are so beautiful, I have to say that. I mean, everyone who walked in the new studio today, I was like, wow, models, they look amazing.
I was thinking the same thing in the operating room today. I was doing this very pretty rhinoplasty, I was thinking the same thing.
Oh my gosh, so, well, for people who don't understand, can you explain what Utopia is and how it's a place for both minimally invasive and just anti-aging and also the more invasive stuff which you would do at the surgery center?
Right, well, Utopia Plastic Surgery and Med Spa is sort of a full service oriented cosmetic boutique, really, if you will. We have a wonderful esthetician who does skincare, and we have something called microneedling, radiofrequency microneedling, just the full array of skincare. Then Cynthia is our nurse injector who does just beautiful filling, beautiful Botox, and as I say, the less invasive things. And a lot of the patients, a lot of the facial rejuvenation patients, like Jennifer, for example, she would have both a surgical and non-surgical approach. And so that really, and even see Natalie too, for skincare and facials and that type of thing.
Yeah, no, I love that. It's your office where you would go for all the non-invasive things is right in Uptown Park.
Which is easy.
Very easy, and it's very welcoming, and I feel like a lot of people who might be watching might be a little bit intimidated to, one, just even call and make an appointment for something like this. Maybe they don't know what all of these things that people are getting injected into their faces are, or even really, you know, what a hydrofacial even is. It can be very overwhelming for people, so I have the experts here to explain. And so, lucky for you guys, we're going to talk about, I believe, do we have Botox today?
We have Botox today.
It's a neuromodulator. What a neuromodulator is it softens the muscle expression. So in other words, patients that are sometimes quite animate in terms of the forehead, or quite animate in terms of the so-called crow's feet, she'll go ahead and inject and sort of soften all of those lines. See, like Nushin, for example, raise your eyebrows, honey. See, and sometimes patients find all of this wrinkling here. We were going to almost inject you live on air.
Oh my
gosh! You don't have anything that needs injecting, Caroline.
Well, thankfully,
you're so beautiful.
I know, I do go get Botox. I've said it on air before. In my forehead, pretty much just my forehead for the most part, because my mom told me when I was like 24, she was like, you do not want the line that I developed. I waited too long to get Botox because it wasn't like as popular mainstream.
Then it can cause a permanent crease.
Yeah, so she was like, you have to go do this because we're so similar in so many ways. We would look, I can't even like squint my eyebrows together right now. But you know that deep line that goes in there?
The so-called 11s.
Yeah, and so over time that would make like a line or a wrinkle. And I love, because I'm 30, turning 31, the whole approach of anti-aging. So not doing anything too crazy just yet. I'm not saying I'll never do anything crazy, but you know, just little things to make sure that I'm keeping the skin looking 30 forever.
Right, and that's very popular. A lot of patients come in and they say, we had a patient yesterday, for example, we did a little Facebook story with that she is hooding at age 28, 29, and she says, oh, my mother's hooding of her eyes is so pronounced that I want to do it now. So it's very common for patients to want to do things prophylactically, you know, in advance before there's permanent creasing.
All right, let's get into some injecting now on Nushin.
Are you ready to go, Cynthia?
What's getting injected?
So we're going to inject her forehead lines today. If you'll go ahead and raise your eyebrows. Up. And then her glabella, which is where her 11 lines are, what you said your concern was. So squeeze your eyebrows hard together. Oh. And then we're going to inject her crow's feet, which are her smile lines around her eyes.
If you pan in,
oh my gosh.
I'll use this little Q-tip. You can see right here. Let's see, Nushin. See, smile, big smile. These little crow's feet, and then get angry, get mad. These little, the so-called glabella region.
Okay.
So those
it's
are
so
the areas.
funny because it looks like perfect to me. But we're going to make it even better. We're freezing it, right?
Exactly.
And it's also prevention. So she doesn't have lines that are there when she's not making facial movements. So doing the treatments now will kind of help prevent those lines from forming and getting deeper as she ages, keeping her looking young.
Awesome. And how does it go? Like how many units, or how would you come up with how much is going to be used?
Yeah, so we went ahead and mapped out her units prior to this. But it's kind of just based on how strong the muscles are and how deep the lines are and what her goals are. So she has one eyebrow that's a little bit higher than the other. So I'm going to place kind of to help even those out and to make sure that she has no movement.
Okay, all right, let's get to it. So basically, I think a lot of people who might be watching who aren't familiar with Botox would wonder, like, well, how do I know how much it's going to cost? Is it by unit?
So it is by unit, and then everyone's just very different on how many units they're going to need. So they would have to come in for a consultation, which is complimentary, to see how many units they need, and it's also based on their goals and what areas they want to treat.
Totally. For me, I don't get like the area around my eyes done, but maybe eventually that would be something I would add into when I go and get things done. Mine's pretty much limited to the forehead, but I have friends of all different ages who have to have all different areas done.
And I might add, it really doesn't hurt. It's a teeny little 30 gauge needle, 31 gauge needle that's very, very fine, very small. And so it's kind of like a mosquito bite, if that. She's going to just do it. You don't need typically anesthesia for this operation.
Yeah.
Not operation, for this injection, I should say.
It really doesn't hurt. I mean, if I have a pretty low pain tolerance, what I don't like about it is that it like crunches. I feel like you hear a little crunch whenever you get the injection. So right now, are you cleaning and disinfecting this?
I'm disinfecting it because we have some makeup on. We definitely want to inject with clean skin.
Okay. And how long does this usually take when people come in the office?
The appointment is about 15 or 20 minutes.
Oh, nice.
So it's a pretty quick in and out. You can do it on your lunch break.
And then after you get Botox, you can't like go lay down or take a nap or work out, right?
Yeah, so the post-care instructions are we don't want to lay down for 4 hours or work out for the next day or two. This is because we want the Botox to stay in the muscle that it was placed in. And then we don't want to do anything hot like a steam room or a sauna because the protein's really delicate, so we want to make sure it kicks in and doesn't break down.
And then if you work out like a psychopath like I do, it gets
together.
Metabolized.
Squeeze,
Yay
angry.
Me. Oh man, here it goes.
Here she goes.
If you don't like needles, look away.
And she's so delicate.
Just like that.
Cynthia's such a good injector. She's very, very delicate. And then she's going to just inject, looks like the glabella.
Oh man.
And then she'll go over to the other areas. And Nushin is a really, really good patient.
She's so still. So how is Botox different than filler?
So Botox is used for the lines that are there when you're making facial expressions. And filler's there to fill volume loss or deep lines that are there when your face isn't moving.
Okay, so what goes into people's lips whenever
that's filler.
That is filler?
So that's to add volume.
Okay. What are the literal non-invasive options, like a hydrofacial?
Well, so this might be, in terms of minimally invasive, I guess the most invasive would be filler and Botox before surgery. But we do things like radio frequency, microneedling, various types of...
I've had that done before, too. I had 2 rounds of it.
On the face?
Yeah.
Did you like it?
I think I did. I mean, it's very
great.
bizarre.
It was fantastic.
We've talked about it on another show that I do, Caroline and Rashi, and basically what that is that's using stimulation. They poke like holes in your face to generate collagen, and then you have to let it heal. So it felt like sandpaper on my face for a couple days. But
well, what it is, it's a microneedling, tiny little needle process that then is hooked to sort of a radio frequency machine, and Caroline is quite correct. It stimulates collagen growth that then can fill.
I got my neck done too. They did it all the way down my neck too, and that was crazy.
Yeah, but when the patient starts this pretty, Caroline, you know, they end pretty. It's it's just in plastic surgery. The more beautiful the patient to start in the hands of a good surgeon or a good nurse injector, the more beautiful they just are.
You're actually really good.
Wow, are you done? Okay, so you can see just a little bumps, but those usually go away pretty quickly, right?
Yeah, those go away in about 20 or 30 minutes. That's why it's kind of a good procedure that you're able to do on like a lunch break, or, you know, when you have stuff going on afterwards.
And you feel fine? Like it didn't hurt too bad? I love that. I love
They
that.
probably think I really didn't get anything.
I know. No, you can see the bump, so I see it there.
She watched it, Caroline.
I love it. Well, good. I'm glad you got your Botox done for the whole world to see. That is so
Bravo,
great. Lucian,
bravo.
great job. Now I want to bring in Jennifer. Can we switch you two out? Jennifer, welcome to the collab.
Hi, Jennifer.
Hi.
Yay, nice to see you.
Jennifer.
How are you?
Thank you for
Hi,
having me.
Jennifer. Thank you so much for coming on. I understand that you recently had some work done by Dr. Rose.
I have. Yes,
Okay.
I did.
What did you have?
February the 22nd, I had a facelift, eyes, and rhinoplasty
Oh my goodness.
for my birthday present, which I'm going to be 48 next Tuesday.
Oh my goodness. And you're looking 21, honey.
I'm 21.
I love it. So, okay, wait, let me go over that again. You did a facelift, a rhinoplasty, and what else?
Eyes.
Upper and lower eyelids, and you can kind of pull back your hair, Jen, and you can see there's no scars visible. Their scars are hidden up in the hairline, behind the ear, back in here. Eyelid scars, you see nothing. A little teeny incision here. Rhinoplasty, nasal surgery, cosmetic nasal surgery is done from. There's no scars. It's all done from the inside. It's hard for sometimes patients to conceptualize that. But
Well, what was the biggest personal desire as to why you wanted to do something that was a lot more invasive than the Botox, which we just saw on camera?
I lost my mother in December, and I cried every day, all day, and I just felt like it aged me tremendously. I think trauma does take a toll on your face, and she got a facelift when she was in her 60s, and I jumped the gun a little bit, but I think that you need to get it before you need it, and I believe I did need it. I was sad all the time, and I didn't want to look in the mirror anymore at myself like that way either. So it was just kind of something I wanted to do, and I knew that Dr. Rose would do a fabulous job.
When did you say you had the surgery done? How long ago?
February 22nd of this year.
Wow.
so about 3 months.
3 months.
So how long was that recovery process for you?
I'm still recovering. My face is still, a little bit swollen, and still some recovery on the nose, but
she
I
was able
healed
to go
pretty
out socially
quickly.
within like 10 days. You know,
Really?
there's still a little kind of nerves coming back and things like that.
What was the pain like?
I don't remember. It wasn't that bad.
Really?
Yeah.
Yeah. Plastic surgery, the whole concept of pain in plastic surgery is sort of kind of left over from World War I, from the reconstruction of World War I soldiers when there was really no anesthesia.
Yeah.
And various flaps and grafts had to be done with poor anesthesia. But these operations, breast augmentation, liposuction, rhinoplasty, etc., they just don't hurt. I know it sounds counterintuitive or prejudicial, but they just don't hurt when they're done properly.
Oh my goodness. Was this the first time you ever did anything to your face?
I had rhinoplasty in '99 for breathing purposes,
Okay.
and I've been doing Botox since I've been 30.
Yes. Okay.
Preventative.
See, I'm not the only one, guys. Don't come at me like I'm crazy. People really they have deep-rooted opinions on anything that's plastic surgery or Botox related, and that's why I wanted to bring some examples on and bring you guys on to explain what it is, what the difference is, and that it's like Botox isn't for me, changing my face, it's literally just helping me not make those lines and not make those squints or whatever that could then lead to me having some deep set wrinkles, right?
Right. So this was revision rhinoplasty. She had had a prior rhinoplasty, as she said, done 25 years ago that was a little suboptimal. There were some things about it was done elsewhere that we had to revise, and then we helped with her breathing, so she's breathing better, I think.
Do you notice a difference?
Big difference.
Wow. And then what about the eyes? You said something with
Upper and lower eyelids. So that's just for hooding of the eyes and a little excess. But again, this is done through the little crease right above the eyes and just through the little lash
But
lines.
I've heard people not even who are in their 20s and 30s, friends.
I've got one coming up who's 27.
Yeah,
who
and
just
they're
has congenital hooding of the
Yeah.
eyes.
Okay, so do you call that hooding whenever you have like when they want to fix the skin under
Right,
there?
when there's
Okay.
a little hooding right above.
Got it.
Yeah.
Because I mean, I can't be putting my friends out here on blast, but I think they'd be okay. I have friends around my age who have gotten that done.
That's right.
And it's like their eyes look more open and they say they look like they
And
feel
they
more
don't
awake.
have to worry about kind of elevating the eyebrow to sort of open up the eyes.
Yeah. And Jennifer, do you have kids?
I do.
How old are they?
I have one daughter, Aubrey. She's 22. She just turned 22.
So as a mom, were you at all ever like concerned about like the messaging of getting anything done? Full disclaimer, my mom never was. She was like, you need to get Botox, you know, that's how she was.
No, I mean, it's real life, and I don't
Yeah.
think there's anything to be ashamed about. To each their own, and she's beautiful, and she's had lips done, lip filler, and some Botox, and she's only 22.
Yeah.
So it's just what people do these days, and I even did it like 25 years ago. So no shame in my game.
I love that. Because there's this is a big topic on social media whenever you see all this. And so it's interesting to hear from you, not only as a patient, but as a mom, you know, how that comes across and the discussion, like any discussions that went into, you know, your daughter wanting to get things done. But I agree with you. Like it is, people do this stuff, you know?
Well, mothers and daughters are very common. Yesterday we did face, neck, eyes, nose, just what we did with Jennifer on a mother whose daughter had just had, like 2 or 3 weeks ago, breast lift.
Wow.
Breast lift with no implants. And so mothers and daughters entertaining plastic surgery, I mean, it's been around for a while.
Yeah.
And it's quite common.
When do you feel like, because you've been doing this for a while,
Forever.
for a while, when did you feel like the plastic surgery world became more like mainstream and accepting?
It's interesting. I'd have to say while I was in practice, I mean, it used to be, I don't know, I mean, there's a certain social crowd that still doesn't want to talk about plastic surgery, but it's become, I don't know, maybe in the era of social media in particular, God, I mean, you can just scroll down Instagram and all you see is, here's my breasts and things like that. So you know, some of it's good, some of it's bad, but I'd have to say over the last maybe 20, 25 years, plastic surgery has sort of come out of the closet, if you will.
Yeah, well, I
don't
mean,
know if that's a good term or a bad
I
term.
feel like it's like, you know, it's like hair. Like if you don't have good hair, like you can get it, you know? So that's like what I did. I just add the extensions in and then it's like, oh my gosh, I love your hair. You have such thick hair. I'm like, well, you could too, you know what I mean?
But that's the whole thing. When plastic surgery is performed properly, it just fits. You would never look at this girl and say, oh my God, did she have something done? It's like that with some news people too. If you see some of the news people and they're too tight, it just is telltale. So you tell all these patients and you have to perform the type of plastic surgery that looks, you know,
you
like
want
nothing.
it to look, you probably wanted to just feel like a better version of yourself if you went in to have something done.
Refreshed.
You wanna feel refreshed. Like you're not trying, I think a big misconception is that people see these like extreme transformations where it looks like, you know, well, that person got a new face or like a totally new look. I think like a good majority of people that go to do plastic surgery or anything that's more minimally invasive like Botox, like aren't looking for a new face or a new look. You just want to feel refreshed and feel like the best version of yourself. Is that correct?
Yeah, I think that's absolutely correct. I mean, there were these reality plastic surgery shows. One was called, I think, Extreme Makeover or something like that. Another was The Swan. And and we've done some of those shows for some of the networks over the years where it's just quite dramatic. Maybe
Yeah.
a patient's lost a lot of weight, but the vast majority of patients just want something very subtle, very natural, very kind of undone looking.
So my last question before we wrap this up is, do you ever feel like it's a slippery slope? Like if one person comes to you for like one thing, does it lead to another and another and another, or are people usually kind of satisfied?
It's always a slippery slope. I mean, I have to say it always is. I mean, you have to just, because you never really, look, I've done 18,000 or so operations independently in private practice, but sometimes you're never 100% sure about that patient's motivation. I think at this point you can quickly ascertain if the patient's a good candidate for whatever procedure you're discussing. But then there's occasionally a patient who's had a beautiful result, but perhaps you miss something in their psychological well-being or makeup that you just missed. So you just have to just be kind and do good work. And
Do people ever, were you concerned about having to be put totally under with like, because I always see these videos.
No, but you're safer under anesthesia than you are driving home.
I mean, yeah, I would, like, I'm sure you don't want your patients to like stop breathing and stuff,
No,
but it
God,
looks
no.
scary because you see these surgery
No,
videos
no,
and that
no,
tube,
no, no.
you had the tube down you.
Well,
Yeah, I was in good hands. I wasn't worried. I said my prayers and
she was
told
done
my
under
daughter I
IV
loved her and went to
no.
sleep.
Oh my gosh.
Anesthesia mishaps in board certified anesthesiologist's hands in a good hospital, a good facility are, you don't want to say a thing of the past, but they're just so infrequent. Like one
That's true.
in I don't know how many thousand.
Yeah.
It's very, very safe.
Yeah, I mean, I scroll like you said, and I see it all, and then I'm like, oh my gosh, that looks so crazy. So I'm just very proud of both of our patients today who came on, Jennifer and Nushin over there, who's doing social media. Love it. For giving us an insight into what can be done and all the different options, whether you want to do something minimally invasive or even not even invasive with just different facials that you can get, or go totally under the knife, which is so brave of you, Jennifer, but you look amazing. So congratulations
A good doctor.
on a great
Thank you.
recovery. You look amazing, and I hope you're so happy with it. And thank you too. Thank you,
you so much,
Dr.
Caroline.
Rose
It's a pleasure.
and Cynthia, for coming on and literally doing Botox on camera for all of us. So we appreciate it, and thank you so much for hanging out with the collab. We'll see you next time.